At Moscow Vision, we do visual exams, eye exams and visual exams, which encompass finding out if somebody's nearsighted, farsighted, has astigmatism, and then beyond that, some of the other issues we talked about, checking their depth perception, eye tracking. I do my workups here, so it's closely related to the learning clinic, because this is where we start in the analysis, which is the first step in helping somebody is diagnosing and the problem and coming up with a plan for treatment and vision therapy. Well, for other people, they may just need contacts or glasses. Stereo vision is very important. That's the ability of the right and left eye to work together, but I guess more importantly for the brain to interpret what the two eyes are putting into the brain. Children need to develop along a hierarchy from rolling over to lifting themselves, to crawling, to walking, and getting their way around in the world. And if this is interrupted or doesn't happen in the right sequence, the two eyes may not function together as a team. So often in vision therapy, we have to work on balance and right-left awareness to work up to the eyes working together in the stereo binocular vision.
Ready? 2. Whoop. So we work on knowing where we are in space and balance. The eyes are all hooked into that. Okay, yeah, nice. I think you're going to be a surfer.
I've been on a billy board, but not a surfboard.
I saw a couple of boys. They happened to be identical twins, interestingly, and had the identical problem, which was they couldn't converge their vision to the reading distance. They had what's called convergence insufficiency, which means once they got closer than about 3 feet, they would see double.
It could be 1, it could be 2. What do you see?
Right now, if I look from this side, I see 1.
Uh-huh.
Sort of 1.
How about when you look at the, what color is that? Blue? Do you see 1 blue one?
2.
2?
2 for both.
Can you ever make any of the beads just 1? They all.
This one actually.
That one you can do 1. How about when you hit the blue one? Can you get 1?
No.
Still 2? Mm-hmm. See, that's a hard one. It's a lot of muscle, a lot of work.
Mm-hmm.
They couldn't put both eyes on the reading material or anything else that close. And subsequently, they did poorly academically. They were in the 2nd grade at the time and had been through extensive testing with psychologists and professional educators. And in the thick report, the comment was, in the vision report was 20/20, no visual problem. Well, this was before they saw me, and I found that they had this eye tracking problem and convergence problem. And interestingly enough, the father had the same problem. And we worked with them in vision therapy to where they could converge to their nose, and went from having a diagnosis as an Asperger syndrome to being normal readers and normal in school. So the parents were very happy, and I was very gratified to see the good results of that. And that's a case of what we can do with vision therapy.
Okay, now he's pretty good at this. You ready? Yay. Oh. Last one. All right. See how fast you can go. I think you're using your peripheral vision. You're not even looking.
Yep.
Are you?
That's exactly what I'm doing.
All right. We're up high.
Seemed like that.
Now see if you can look right at it and see if it goes faster.
Is that 45 or 42?
That's 45. Have you got? See a successful right and a successful left, and oh,
Almost.
hey, all right. Let's see.